Bismillahirrahmanirrahim and Assalamu alaikum. Today I am giving the presentation on the topic of phlebotomy, that is obtaining the blood sample. Learning objectives. Students should be able to know the importance of blood sample collection. They should be able to identify the prerequisites of sample collection. They should be able to explain the procedure to the patient or the subject. Phlebotomy. What does it mean? To cut a vein. It is a Greek word. It is the process of making an incision in a vein. It is associated with the venipuncture, the practice of collecting venous blood. A person who performs phlebotomy is termed as phlebotomist. Phlebotomy procedure. Locate the suitable site for blood sample collection. Use the tourniquet correctly. Take out the blood under supervision. Label the sample. Discard the syringe. Needle lens it properly. Should be aware of the patient's feeling and occasional fainting and fear during the procedure. Requirements: split swab, disposable lancet, disposable syringe, tourniquet. Procedure. Blood is the requirement for the hematological examination, and it can be obtained either by pricking the fingertip or ear lobule in adults or from heel in neonates. Before taking the sample of blood, area is cleaned by the help of a split swab. Gentle pressure is applied so that the blood oozes out from the site of puncture. The first drop of blood contains more tissue fluid compared to the second drop. Venous blood. Venous blood is generally taken for routine physiological and biochemical tests. The most suitable vein is the cubital vein. Venous blood. It is a proper size disposable syringe is used. Before obtaining the blood, area is cleaned from the center towards the periphery to avoid recontamination. Tourniquet is applied to make the veins prominent. However, it should be kept in mind that prolonged use of tourniquet leads to the stasis of blood, resulting in heme concentration, which gives false readings. Therefore, blood should be obtained with minimum stasis by applying tourniquet for minimum time. Venous blood. Identify or feel the vein in the cubital fossa. Insert the needle into the vein through the superior and anterior aspect of the vein. Avoid double puncture. Venous blood. When the needle is properly inserted, the blood is seen coming through the nozzle of the syringe. Pulling the plunger. Draw the required amount by pulling the plunger of the syringe slowly and smoothly. Should be kept in mind that every small needles and forced pulling of blood out of the vessel leads to hemolysis. The spirit swab. After taking appropriate amount of blood, draw the needle of syringe out. Put the spirit swab for quite some time. Apply sterile bandage for proper size over the area. Arterial blood. It is obtained to measure arterial blood gases. Special precautions are taken to prevent hematoma formation and double puncture. Therefore, pressure is applied for some time after drawing the blood. Usually, the brachial artery is chosen. This is the brachial artery, and you should palpate with the help of 2 to 3 your finger at the site of elbow. Capillary blood. It is obtained by pricking, and it is used to determine blood grouping, to calculate the bleeding time, clotting time, and the cell counts. In emergency, when no vein is visible, it is becoming difficult to get the blood sample, then femoral vein is tried. It is easily located after identifying pulsation of femoral artery, and femoral vein is medial to the femoral artery. Precautions. Through the cleaning of the area selected for drawing the blood is essential. Syringes, lancet, and needles must be discarded properly. Never try to recap the used needle, as it may hurt you. Needles must be broken by needle cutter and or the distro clip. By proper handling the use of the disposable syringes, one can help in preventing the communicable diseases like AIDS and hepatitis. Although the larger the medial, cubital, and cephalic veins of the arm are used most frequently, the basilic vein on the dorsum of the arm or dorsal hand veins are also acceptable for venipuncture. Foot veins are the last resort because of higher probability of complications. Medial cubital vein. The medial cubital vein is the superficial vein overlying the bicipital aponeurosis in the roof of the cubital fossa, commonly cannulated for intravenous access. It variably forms either a H or M type pattern joining the median antebrachial basilic or cephalic vein. The cephalic vein is a superficial vein of the upper limb and it's one of the two main veins of the arm. Its name derives from the cephalic mean head as the vein runs up to the shoulder. The superficial venous network is the source of blood for most blood tests and is the easiest place to access the venous blood. Basilic vein originates on the medial aspect of the forearm at the wrist from the dorsal venous network of the hand. It runs superficially in the forearm and usually communicates with the cephalic vein by the median cubital vein at the elbow. The dorsal venous network of the hand is a network of veins within the superficial fascia on the dorsum backside of the hand. It is formed by the dorsal metacarpal veins and give rise to veins such as cephalic vein and the basilic vein. The veins on the dorsum of the hand. The venous drainage of the foot involves several vessels, including the plantar and dorsal venous arches, the great saphenous vein, the small saphenous vein. The plantar and dorsal venous arches of the foot have arches. The large medial and lateral plantar veins that eventually join posteriorly to form the deep tibial veins and anteriorly form the anterior tibial vein. These veins contribute to the plantar pump, a physiological mechanism to propel the blood back towards the heart. The great saphenous vein is also a common graft source for specialized conduct bypass surgeries to manage the various cardiac, thoracic, neurovascular, and urological pathologies. Arterial and venous blood. The arterial blood is mainly used to measure the acidity, pH, oxygen concentration, carbon dioxide concentration in the blood. The test method is called the arterial blood gas test. It is used to check the efficiency of the lungs to remove the carbon dioxide from the blood as well as to take the oxygen into the blood. Arterial and venous blood. Arterial and venous blood flow within the blood vessels. Both the arterial blood and the venous blood contains the same amount of hemoglobin. This is the difference between the arterial blood and the venous blood. Thank you. That is all about the phlebotomy.